A hearty good afternoon and welcome to a session on. Excuse me one second, we are having some technical difficulties. A hearty good afternoon and welcome to a session on when and why is hysteroscopy required in IVF. We are glad to have Dr. Ramya Mishra among us today to help us explore the topic. A hysteroscopy is the process that helps us examine the inside of a womb and helps us determine its health. So, as part of the IVF process, a hysteroscopy helps in making sure that the uterus is healthy enough for an embryo to implant and grow. So Dr. Ramya will help us understand and take us through the process and help us better visualize the process and its benefits. So Doctor, you have the stage.
Thank you, Sean. Thank you. Thank you for giving me this opportunity to be here and let people know about this very simple and yet very informative topic of how to go about or when to go about hysteroscopy. First of all, let's see what a hysteroscope is. See, hysteroscope is an instrument which is used to see into the uterine cavity. Okay, and when we see patients, especially for for infertility cases, we have seen that there are many cases where there is a mandatory hysteroscopy is done before IVF. So today we will see when you actually need to go for hysteroscopy. What are the indications? What are the what are the things what are the benefits of getting a hysteroscopy done, or what are the complications, what is the hospital stay, all these questions. So we are open to the session now, and if any of you are listening to us, then you can ask, you can put your comments, your questions in the comment box, and I'll be happy to answer them. So for now, let's start it. So as I told you in the beginning, hysteroscopy is a procedure which we use, to see in the uterine cavity. Okay, so it's a daycare procedure wherein, first of all, planning is done for this. We see the patient when they come for infertility workup or something. We do the ultrasounds. We examine them on particular days, and we see the if there are any pathologies which are visible in the ultrasound, like you have endometrium, you have any endometrial pathologies, the thickness of the endometrium, the blood supply of the endometrium, any polyps are visible in the uterus, or any fibroids, if they are visible to us, then we may resort to procedures like hysteroscopy to see and to correct them. So there are two kinds of hysteroscopy. One is called diagnostic hysteroscopy, and the other is called operative hysteroscopy. So in the same setting, you can convert the diagnostic hysteroscopy into an operative one if you find some kind of pathologies. So whenever your doctor says that yes, your ultrasound report says that there is a polyp, so it's a small growth into the uterine cavity where it can hamper the implantation process. Okay, so your doctor may give you the advice of getting a hysteroscopy done, wherein they will go inside the cavity, they will cut out the polyp, and they will take it out and send for further examinations if required in the cases. Okay, so this further improves the chances of getting a positive implantation rate, either in IVF or in natural cycles also. And see, after the ultrasounds, if the report says that yes, the thickness is less, the endometrial thickness is less, in that case also we can go into the uterus, or we can find out if there are any septum, or some sometimes there's a broad spectrum condition, like wherein you have the implantation is hampered. So these kind of cases can also be taken care of. Some patients have got some intrauterine adhesions also. So this also can be utilized, this process can be utilized to see and to cut the adhesions which are there, because this is the reason of not getting a positive outcomes. Sometimes we have patients who come to us who don't have, like, who are getting repeated IVF failures. Therein also we advise them to go for to go and undergo this procedure, wherein all the pathologies can be taken care of, and you may get a positive outcome of a better implantation rates after that. Till now there are no questions here. So now let's see, if you are planned, if your doctor has advised you to go for hysteroscopy, and so what are the preparations you need to undergo. So generally speaking, the process is done under anesthesia. Anesthesia is, the full general anesthesia, wherein you have to come to the hospital empty stomach, that is without taking even water, without sips of water. You have to report to the clinic they have advised to go, and all the investigations will be done beforehand only, all the required investigations. You will be taken, you will be seen by the anesthetist in a pre-anesthetic checkup. It will be done for you, and then you may be taken for the process. The process, will you will be giving some kind of medications also, if you, as your doctors advised. So the process is done, you're taking into the operation theater, the process is done. It does not require any kind of surgical marks on the abdomen or somewhere, because there is a small scope kind of thing. There is small scope which goes into the uterus, and nowadays very very thin scopes are available. And in fact, you can go for office hysteroscopy also, whereas you don't need any anesthesia also. So these are also available now. So the process will be done. The doctor will go into the uterine cavity, will see your, there are some there are ways called the fallopian tubes are there, which are attached to the uterus with the help of the ostia. So that can be visualized there. We can see if there are any polyps there or any fibroids are there, and in the same sitting, your doctor can take them out. They can take them out of it, they can send them for testing, and the uterine cavity may be okay after that. So after the process is done, you'll be taken out, you'll be kept in observation for some time, like 3 or 4 hours, and then you can go back to home. There is no requirement of staying overnight in a hysteroscopy procedure, unless you have some other indications for staying there. So no need to worry if you have been advised to go for this process. There are, we have seen better results after getting a hysteroscopy done. But yes, there is one thing which I would like to know my audience, is that it is not a mandatory procedure before we proceed for an IVF process, because your ultrasound or sometimes HSG also gives you enough information that whether this patient should undergo this process or not. So this, you have to discuss, you should discuss with your doctor, that whether you actually need this process or not, because there are some other simple procedures also, we call them endometrial scratching or something, where you can, the similar results are also seen. So there are any comments here? I cannot see any comments till now. Sean, do we have any questions? I cannot see. We have one. Yeah. Uh, Doctor, how long does the process takes? See, the exact process, if you ask me how much time does it take, so it completely depends, because sometimes we, add hysteroscopy along with laparoscopy also. So that may be, done together. So you may have to stay for long because of the laparoscopy process done. So that may be an overnight stay or a two. But in case it is only a hysteroscopy procedure, you don't need to stay for full night. You just need to stay for 5 to 6 hours in the hospital, wherein the process will actually take only half hour to 1 hour, half an hour to 45 minutes only, if there are no complications. So it is not a very lengthy procedure, and you don't need to go for stressed out or all. You can take a 1 day leave and you can get it done at your ease. Okay. uh, we have the same questions here. How long does the process take? It takes, I just now answered it. There's one more question here. What are the complications? See, complications completely depend on the difficulty involved, because sometimes there is stenosis in the cervical canal or the ostia, or the the passage from where you go into the uterine cavity. So that negotiation may say sometimes take time. If the passage is narrow, so we may have to use the dilatation procedure to get the scope, to negotiate the scope into the uterine cavity. So this can be a bit, it can increase the time of surgery, operating time, it can increase definitely. Or in cases where you have to take out the myoma or the fibroid in the uterus, if they are there. So these, or there is a septum, there's a thick septum inside the uterine cavity. So in these cases, it may take a longer time, or there may be a bleeding in from the after cutting, or after using during the procedure. So this may take, this may ask, this completely depends upon your doctor. So whether they want to abandon the procedure and they want to proceed for the rest of the process in the next sitting or not. So there are very minor complications. Sometimes they, because we use normal saline, or some media is used for uterine distension. So if that is not taken care of properly, or if there is some lengthy procedure, so this sometimes it happens that you may go into other complications. So that completely depends upon the expertise or the the process you are going for. Okay, there's a one more question here. So now, one more important thing which is left. We are just waiting for the comments to come or the questions to come. There are a few more. This process can be utilized to diagnose any kind of congenital abnormalities also. See, sometimes when we have the female body is there, when the formation of the embryo or the baby or the girl, the uterus forms from two different tubes. Okay, so these tubes, they merge together and they form the uterus in their current in the normal shape. So sometimes there may be anomalies, like one of the tubes is not there, one of the tubes is not properly formed. So you may have a unicornuate uterus, or you may have a septate uterus, which I told you. You may have a bicornuate, like with the different terms for that. So you may have two uterine cavities also if the the joining septum is not dissolved at the right time. Okay, so we may utilize this procedure also to diagnose them and to correct them, because there have been many cases where the patient is not able to conceive because of the hindrances which happen to the normal implantation procedure because of these abnormalities. So these kind of patients also come to us because natural conception is difficult in them. So we can definitely add them up with laparoscopy, and we can do a final diagnosis as to whether this the uterus is in which shape or in which condition, and how it can be taken care of. So that is definitely possible with this procedure. I personally feel that yes, we have seen very good. There are studies also which have told us the same thing, that hysteroscopy is actually beneficial for those, especially pre-IVF hysteroscopy is beneficial for those. Yes, it is not applicable if you find a good endometrium, if you have a good flow of blood into the uterine cavity. Definitely you don't you don't go into that criteria of getting a mandatory pre-IVF hysteroscopy. But yes, if you have minor abnormalities or this diagnosed into the ultrasound, you can you should go for it in those cases. We are not able to see any, I mean, comments for now. So one more thing which is there is that if you have supposingly there are some fibroids in the uterus, okay, and those fibroids are hampering the implantation process, then this we can utilize them. Sometimes the position at the cornual area, that is the place where from where the sperm goes into the uterine tubes, is sometimes obstructed. So that is the area, that is the these are the cases where we have seen that if they are removed, you see the very next cycle you see a good a good outcome, or a natural conception also may be there. So to me it appears that hello. Yeah, So, if hysteroscopy is done along with the laparoscopy procedure, it definitely helps the patient, because there we may see the outside of the uterus also. So when you can see the outside area of the uterus, you can do your diagnosis can be made in a better way. If you find any kind of hydrosalpinx, or you that is fluid filled in the tubes, you can use it to treat it. You can clip the tubes, you can do it in the same sitting along with the hysteroscopy procedure also. So to my personal opinion says that if you need to go for it, because after doing the procedure only, after doing the procedure of hysteroscopy only, sometimes you may, in the next sitting, you may see that the patient is having some or the other problem. So you have to do it separately for that. So it is always advisable to examine the patient beforehand, before we jump into any kind of conclusion and we go into the process of doing hysteroscopy or not. There's one more question here. What all can a hysteroscopy show us or tell us about the patient? See, whenever we see patients of who are there, who come to us for infertility, first of all, you have to fully examine them. You have to take a detailed history. You have to know about what happened in the previous cycles, what all was done, and now how we can proceed and how we can give them a better outcome. So in that case, after doing all the pre investigations for for that couple, we advise them to, if this has not been done earlier, then we advise definitely them to go for a for an inside view of the uterine cavity or the passage also, because that difficult passage also sometimes hampers the implantation process. So if you have, or there is a history that the patient had a difficult IUI or a difficult other procedure, other uterine procedures, then definitely you should go and see, because seeing and treating is the best thing. Okay, that is the beauty of hysteroscopy only. You can, even if you have, because most of the things which we do is based upon the ultrasounds or some of the reports, but when you go and you see inside it, you can definitely do, you can give them a better, the insight of the uterine cavity, the blood supply also. Sometimes there's a thing we call, it's small kind of we call it Mr. Metroplasty also. Some kind of cutting into the uterine cavity also gives a better outcome, because the blood supply improves in these kind of cases. So if you have repeated implantation failure and your ultrasound says that everything is fine, still we recommend to go for a hysteroscopy to find out the minor details. Okay, minor detailing, as in there may be some of the lesions, like some mucus things, smaller ones, which may go undiagnosed, which may not be able to diagnose them at the right time. So the stenosed also may be there. So these kind of things we can definitely take care. We see them, and these candidates may be having a better, the flushing of the endometrial cavity also gives a better outcome in the next cycle they plan it out that way. And moreover, it's not a very expensive procedure. Many of the insurance companies are also covering it there, so you can get it done from a good center, from a good place, and you can be benefited from that if you're not getting your things no your diagnosis made at the correct time, this way. Uh, the question is: a hysteroscopy always part of an IVF process? I would say hysteroscopy. To my personal opinion, I definitely don't use it as a compulsory part of my, for my patients, because it is completely, your ultrasound can give you a good idea, indication of the real candidates. But yes, if you have repeated failures or repeated implantation failures, repeated abortions, these kind of cases, if you see, then definitely going into the cavity, looking for it, observing it, gives you a better outcome or edge in the next cycles. So I would definitely not say it's always a part of an IVF process. It has to be individualized on case to case basis, and you can see, and you can then let them know whether to get it done or not, that way. I think if you have any more queries, more questions, you can put it down here. We can always answer them, or later in the session also. Later, after the session is over, also if over, and you have more questions, you can put down the questions in our comment box at our YouTube channel, and we'll be happy to answer them. Thank you. Thanks a lot.